Habari zenu? Okay, you can take your seats. Thank you very much. The Chair, Paul Ndungu of St. John's, and all the other leaders, St. John community. I'm told there are dolphins, and then there are cadets, and then we have links, right? All those categories, I want to welcome all of you to this very important morning parade. Congratulations to all of you for what I see as a great movement, and it is my pleasure to join you for this year's annual parade and inspection. This occasion is a commemoration of St. John's Day, a celebration of the milestones and achievements of this organization, and a chance for all of us, including me, to rededicate ourselves to the values and goals of St. John Ambulance in Kenya. Today I commemorate this day with you, an honor that I accept with humility and respond to you with a genuine eagerness to support you and to strengthen emergency and pre-hospital care in Kenya through the individual and collective contribution of this great St. John's Army that I see. The cultural consensus amongst most opinion shapers in Kenya today is that there is a lot of individualism, there is a lot of selfishness out there, and that most people are looking out just for themselves, and that the values of selflessness and service to others has become very remote. The existence of the St. John's Ambulance and over 26,000 volunteers breathes some fresh air to us as a nation, that there are indeed people out there who want to look out for others, for the good of others. I want to say to all of you, congratulations for being part of that team. We were told, we attended the prayer breakfast the other day, and we were told, if you can feel pain, you are alive. But if you can feel the pain of others, then you are a human being. And I think St. John's embodies those who feel for the pain of others, and they step forward to do something about it, to help in situations that are of an emergency nature, situations that otherwise could lead into loss of life. And I want to say to all of you, congratulations. You have our support as you bring up the children, the younger ones from age 6 to, the dolphin are 6 to 12, right? And I see many of them here. That is very good training. Emergency and pre-hospital care is an integral component of quality health care services. We are committed to, as expressly expressed in our agenda and articulated by Minister here, to the provision of quality, affordable health care and the achievement of universal health coverage in Kenya. And that is why preventive and promotive health care is important to us. It is very important that we work towards eliminating instances where people are hospitalized. We are presently developing strategies and policies to guide implementation of emergency and pre-hospital care. As the Minister has told you, we are in the process of formalizing the engagement of 100,000 community health promoters in Kenya, working between the national government and the county governments so that we can begin to respond to matters health at the earliest possible age in every village, in every town, and in every part of the Republic of Kenya, because we all agree that sometimes hospitalization becomes very expensive. Many people, it gets out of the reach of many people, and therefore we have to rethink, re-engineer, rework our plan, our strategy on how to deliver health. And I see the participation of St. John ambulance volunteers in working with our community health promoters. And I am happy that I have been told that it is the vision of St. John to make sure that in every family there is at least one person who understands something about emergency and emergency help. We will work with you to make sure that your vision becomes a reality. At the same time, we are developing a comprehensive architecture for health financing, including emergency medical fund to enhance access to emergency medical care for Kenyans, irrespective of their social status. I applaud St. John for the leadership and commitment to supplement government efforts in provision of emergency and pre-hospital medical service to Kenyans during emergencies and disaster, including when we had COVID-19 pandemic. Your gallant services have saved thousands of lives, and I thank you on behalf of very many grateful people who are beneficiaries of the services offered by St. John. I am also pleased to hear that we share a belief in empowerment from the grassroots. I am pleased to learn that your target to ensure every household in Kenya has an individual who is trained in first aid across the country becomes a reality. This is actually bottom-up in full effect. I acknowledge your contribution to both the emergency medical care policy and the emergency medical care strategy. Your input in making sure that we have a policy framework that ensures that the country is seized with the matter of emergency medical care is a huge contribution that you have made. We intend to build on it as we work on a new legislative framework and policy framework that we are currently developing that is going to take